Hi everyone, we're back. It is 9:22. We are now 5 episodes into the first season of the Golden Bachelorette. As of last night, there are now 4 men left as Joan continues her search for love.
Well, our KSTP health expert looks for something else when she watches the show. Dr. Arkel Giorgio is here to tell us about the medical issues that have come up among the 57 to 60-year-old bachelors. This is very interesting, and I understand you are loving watching this show.
I love this show.
But you're watching it and seeing things that maybe Chris and I aren't seeing when it comes to what's going on in these men's lives.
Yeah, I can't help it. I mean, when I watch a show like that, when I go out to a restaurant, I'm always looking around and thinking, wonder what condition that person has. Yeah, sorry, that's the truth.
No,
what are you thinking now?
That's what you do for a living. Like, I totally get it.
Right.
Some of us can relate to some of these issues quite well. One of the things that jumped out to you was the snoring that they were talking about.
Yes, so there was a clip that they showed where some of the guys that were living in the mansion, they described how their roommates were snoring. And they were describing snoring where those guys were so loud and there was a long time between breaths. And so that makes me worry that this isn't just snoring. It is no laughing matter because they could really be suffering with sleep apnea. You know, 30 million people in the United States have sleep apnea. 80% are not diagnosed. And the risks of sleep apnea are really huge. I mean, in addition to having an unhappy bed partner, which is also a complication of sleep apnea, you can develop heart problems, lung problems, liver problems, type 2 diabetes. I mean, there's significant numbers of issues that can go along with having untreated sleep apnea. So I think it would be wise for these men, after they get off the show, I guess they're already off the show, to be evaluated.
Look, I want to show a quick clip
let's
of
show
something that they posted.
Apparently, I'm a snorer, but how would I know? I'm asleep when it happens.
I mean, this is nothing compared to what he does. I mean, I can't even do it. And that's been very nice.
No wonder I can't get a date.
So they're joking about it, obviously, but Dr.
It's
Giorgio,
no
you're like saying it's
joke.
not a joking matter.
It's
and
not.
To differentiate between what is just considered normal snoring and sleep apnea, you've got to do a sleep study. That's kind of where you get started on that, right?
Right, but let's just talk about what some of the symptoms are, usually for the person who's sleeping with the individual. One is that sleep apnea tends to be a little louder than regular snoring. 2 is that there's this gasping as opposed to just snoring. There's pauses between breaths, so you think, oh my God, is the person breathing at all? And there's daytime sleepiness because they get such a poor night's sleep that they're sleepy the next day. But don't guess if you have any concerns about this. Yes, you're right, Chris, that a sleep study is what definitively diagnoses it.
So you get in touch with a sleep expert and you go down that route. You say, do a questionnaire, kind of figure out if you've got the right symptoms.
Exactly.
Have you do a sleep study, which isn't as complicated as it used to be either.
True. So when you say sleep expert, it would be great to go to a sleep expert, but you could go to an ear, nose, and throat doctor. So they're more common than just a sleep expert. And there are 2 ways to get it done. You could have a home sleep study, which is a little easier to do. It's certainly more comfortable. It measures your breathing. Or you could have a sleep study done in a center, which also measures your brain waves. So it's a little more accurate, but a home sleep study has really increased the number of people who are willing to do that study and get diagnosed, which is what's most important.
Okay,
Excellent.
let's move on to this next health issue. You noticed that the men were negotiating on which bunk they were going to sleep in. We've got a clip here. Let's take a look.
Guys, I just can't do the upper. I got my knees.
I'm okay with it. It's just that sometimes I will get up 3, 4, sometimes 5 times a night.
Oh my gosh.
To spell that out for
Well,
everyone if
he's
you didn't
certainly
figure it
not
out, to go to
sleeping.
the bathroom.
Yeah.
To go to the bathroom. Okay, so that is not normal.
And that guy is an emergency room doctor. I'm shocked that he said that because he needs to go to the doctor. So anything, getting up to urinate more than once a night is something that should be looked into. Sometimes it's just as easy as you are just having too much fluid before you went to bed that night.
Too much water, too much tea.
It certainly could be that. It certainly could be that you're on medications that make you urinate more frequently. It could be any of those 2 problems, but it could certainly also be other issues that need to be addressed.
Okay, Very interesting.
So what
He
are
gets up
those
5,
issues?
6
Did you
times a
notice
night.
that I said urinate instead of pee?
Yes,
So
yes.
I know you started laughing when I
No,
when
I'm
I changed
laughing because I get
the
up
word
at
that-
least 3 times every day.
Okay, Chris, let's talk about that after the segment.
Like
But-
I told you, a lot of the stuff hits a little close to home. What were you going to say?
But it, there is something else that could be causing it
Yeah.
if it's not too much fluid or medication, and it could be, bladder problems, prostate problems, so common, heart failure. Can cause waking up at night.
Yeah.
Sleep apnea can cause somebody to have to urinate more frequently at night. So it's important to get it addressed.
Take it seriously. All right. One of the more dramatic health issues took place apparently right before Dan's ribbon performance for the talent show. Check this out.
I'm not nervous. I have a little bit of a tremor, so when I looked at these, I'm like, this is perfect for my shaky hands. You guys know this. So this is for you, Joan.
Okay, so he admitted to.
Did you see his hand
Having a
shaking
tremor.
right there? Yeah. So what is that?
What is that?
So he called it a familial tremor. His father and his grandfather have it. A familial tremor is also called an essential tremor. Most of the time, it is genetic. Not all of the time, but most of the time it's genetic, as he says that it is in his family. So it's characterized by these hand tremors. You can also have head and voice tremors. The tremor is not at rest. It's when you're reaching out. So it's when gravity takes a hold of your arm. And it is not a condition that turns into Parkinson's disease. That's really important to highlight. Some people think, well, is this early Parkinson's? No, it is not. But you do need to be evaluated to determine which is it. Is it an essential tremor or is it Parkinson's? And there are certainly a few things that can be done to treat it. Sometimes people don't need to be treated at all,
Sure.
but other times some medication can treat it. Physical and occupational therapy can treat it. There are other types of devices that can be used, like nerve stimulators that have been shown to work. And for some individuals that have very serious conditions with essential tremor where it interferes with their daily life, there's some really invasive deep brain stimulation interventions that can be used.
Can the tremors, diabetes have anything to do with the tremors?
No, diabetes, not that we know of.
Yeah.
So we actually don't know what causes it in the brain. There's some wiring issue in the brain that causes it because of the genetic effect, but diabetes has not been linked. So
Okay.
I know he also said he had really brittle type 2 diabetes a few years back where he had a pretty serious condition, but those don't seem to be associated.
So in regard to that particular
Yes,
bachelor. Okay.
yes.
Okay.
This is very interesting. You're loving this show. I love that you're watching it. I just think this, again, they're all relatable, but it's just a fun show to watch.
Well, it is so fun. And again, I'm going to make it a little more serious as well, which is to say that I think that this show has redefined aging, right? It has shown that as we get older, we still need and deserve and can participate in love and romance and dating and fun and activities. And I just think it has shattered some of the stereotypes of people who are aging. And I think it's a beautiful, beautiful show.
Oh, I love that.
Yeah.
Thank you.
Thank
you,
Great
Dr.
having you.
Giorgio.
Really
This was
fun.
fun.
Appreciate it.